This is the official definition of vaccine hesitancy, according to the World Health Organization. But it's become a catch-all to broadly describe the unvaccinated.
Vaccine hesitancy can mean 10 different things to 10 different people.
This is Monica Shock-Spana. She's a senior scientist at the Johns Hopkins Bloomberg School of Public Health and the co-principal investigator of CommuniVax, a national coalition focused on vaccine equity. She says naming vaccine hesitancy as the problem or blaming minority groups
many people in Black and brown communities are refusing to take the vaccine
can conceal issues of access, especially in low-income communities of color. Shock-Spana and a group of researchers studied why members of Black and Hispanic communities weren't getting vaccinated.
If we don't diagnose the problem correctly, we're not going to be able to implement the right treatment.
So let's diagnose the problem. The research team found that hesitancy isn't the only reason people are not getting vaccinated. In the Hispanic community alone, there are dozens of reasons why a person has delayed getting the vaccine. Misinformation was one.
My granddaughter, she said, I'm planning to have a baby in 1-2 years. I don't know what's going to happen with my baby.
We also hear in terms of, the chip, the microchip, and we work hard to inform them. We have had this vaccine long enough to get good research data showing proof that that is inaccurate.
Access was also a problem. Many Hispanic adults said there were technology, transportation, or language barriers.
Is the problem the fact that a monolingual Spanish speaker who doesn't have a digital device cannot get an appointment to get vaccinated?
Communities of color are not homogenous, and infrastructure issues in the public healthcare system can exist in some places and not in others.
So what does that mean? Well, it means that the health department in Baltimore City, which deals with a Black majority population, was not well equipped to meet the emergency needs of a new and growing segment of the population, many of whom are monolingual Spanish speakers.
Some immigrants and their family members said they feared accessing the vaccine due to their status and being asked for an official government ID or social security number.
They don't want to draw attention to themselves or to their larger network.
Vaccines are free for all U.S. residents and adults, regardless of immigration status or access to insurance. But some have still been turned away. While many states allow vaccinations with a utility bill or work ID, that information is not readily available. In rural Idaho, the local research team worked with the health department to change their ID practices.
It's changes like that, changes in how public health invites people in to take advantage of a service and good like vaccination that make a difference.
So what now? As the pandemic continues, Shock-Spana believes overcoming these barriers will require a hyper-local strategy.
We have to bring vaccination information and the vaccination experience to places that are considered familiar, safe, and convenient for people.
Nearly half of unvaccinated Hispanic adults say they are more likely to get vaccinated if it was offered at a place they normally go to for care. 4 in 10 said they would get vaccinated if their employer arranged it at their workplace. Researchers and advocates say it's important to support trusted community-based organizations and healthcare workers who are already doing the work on the ground.
They trust us. They know organization, they know me.
That portion of our health system is ad hoc and fragmented. Our community health system needs to be more socially valued, more operationally functional, and also sustainably financed.